Are they complaining about like, oh, I don't like this food? Or, I mean, because most people like, I know my diet, and I'm not expecting that they're feeding ribeye steaks. When I go down and eat a ribeye steak, I'm like, it's pretty good. I don't mind it. I like it every day. So.
Oh, I love eating ribeyes now. She has said this is getting old. There's not a lot of variety, so we've tried to mix it up. We tried to make some stews. I bought a bunch of like barbecue spices and things like that, and that's helped a lot. And we've introduced more fish. The trainer does let her have some vegetables, like a cup full of Brussels sprouts or broccoli or asparagus, things like that. And that's helped some too. So I can't say we're 100% carnivore with everyone, or anyone, but the bulk of it is, and that's what's made it different.
Yeah, and that's putting high quality nutrition there. And I always said if you just decrease the junk food, increase the meat, you're going to see a big health gain. And I think that holds up, and you're showing that as an example. Are you getting more and more? You mentioned you're starting to get more and more referrals. People like, if you become a bariatric facility primarily, which, this is, because you can't, if somebody's 90, you're not going to turn them into a 60-year-old. I mean, they're still 90.
No, absolutely.
But I mean, I think you have a huge potential to take these 500-600 pound morbid obese people and rehab them and get them back into life. That's neat. Are you seeing, like I said, but I certainly think, and Del Bretta's in, with his protocol, but I think a carnivore diet would actually work quite well as well. Are you seeing some cognitive benefits in some of these older folks when you change their diet?
Yeah. The lady we got on the Bredesen protocol, we think the primary problem with her is her mouth. She's got a lot of those teeth issues. We took her into the dentist to get what's called a cone beam scan, which is kind of a CT scan for your mouth and teeth. She has infections all over her mouth. And the company I'm working with, Mind for All Seasons, is convinced when we get that fixed, you're going to see a dramatic improvement in her dementia. The trouble is what she needs is about $20,000 to $25,000 in work. So we're working through the insurance companies to figure out how we're going to get insurance to pay for most of that. But in the meantime, we put her on the carnivore, or we give her like eggs for breakfast and bacon. We give her meat for lunch and everything, very little dinner. And we try to do it at like 4:30 in the afternoon so she can fast till about 8 the next morning. And my manager's like, holy cow, she remembered everyone's name in the house the other day. And she told me what we did yesterday. And for her, it was like Groundhog Day when she came in. Every day she'd be like, okay, today's the day I'm going home. And we're like, okay, great. And then at the end of the day, it's, oh, well, I guess they're not going to pick you up. Why don't you stay one more night? She's starting to remember like, hey, wait a minute. How long am I going to be here? I've been here like 3 months now. And what's interesting is when we had Thanksgiving, we had a big celebration of Thanksgiving, families coming in and everything. And then when we had a birthday party for someone, and she kind of cheated on both of those days and had a little of a dessert, stuff like that. My manager said she couldn't remember where her room was. It's not like it fixes it. It's, if you don't cure dementia, you put it into remission kind of. Yeah. But if you start cheating again, it comes back. And Dale Bredesen says that a lot. But the carnivore definitely seems to be working because we're waiting on the dental stuff. So in the meantime, we're doing the carnivore plus some vitamin stuff, and it's making a difference.
Yeah, that's exciting to see, and I'm not surprised by that. I've just seen anecdotally, I've seen similar stuff happening, and one of the things is, it shows you how powerfully negative or almost poisonous some of these foods are. When you say you eat a piece of birthday cake and all of a sudden you don't remember where your room is or something like that, it's kind of shows you the power the food has, particularly in somebody who's already got compromised physiology or illness. Somebody's asking about, I mean, obviously morbid obesity, we see that, but are you seeing the opposite end of the spectrum? Are you seeing people that are emaciated, like cachectic and just wasting away, like sarcopenic? And how do you, I mean, again, I know that your sample size is not big yet, and this is something we'll probably see, a couple of years from now, you'll probably be able to report on this, but are you seeing people regaining strength and putting on some lean mass?
Yes. Between the protein we're giving them and the personal trainer we weigh them every week, and we've definitely seen improvement. We do get, especially the ladies, older ladies come in looking like Ethiopians, some of them. And we do see them weight gain, and the family's thrilled when they see that. Also, we see when they gain some weight, a lot of times their mobility gets better. Like we've had people who are bedbound get into wheelchairs. We've had people who are in wheelchairs start walking with a walker. We've had people with walkers be able to walk without the walkers. And you can imagine the sons and daughters are absolutely thrilled seeing that kind of stuff.
Let me ask you about the staff, because one of the problems is a lot of people just don't want to work in a nursing home because it's depressing and it's, you know, it's not fun work, you know, changing bedpans and moving people around, and, you know, it's tough. And are you seeing like a more energized or excited staff when they get to work with these people that are actually sort of winning, I guess, for lack of a better word? Are you seeing some people like staff excited about this stuff?
Oh yeah, I definitely do. I mean, that manager who's helping the dementia patient is like, holy cow, this really works. And that kind of feeds on itself. So she helps with the meals to try to keep her that way and start moving those meals to other residents too. I've been very blessed. My staff, I consider my family. Most of them have been with me the whole 6 or 7 years I've been doing this. There's a lot of turnover in this industry for the reasons you cite. It's depressing and no one's getting better and things like that. But when they see it get better, they're very energetic. And I tell them, because we have people getting better and because we can tell them these stories, my rates are going up. And when my rates go up, the staff rates and pay goes up too. Like I said, they're part of my family, so they're going to share in this, you know, and then they get family phone calls of, I'm thrilled with this, rather than, what are you doing to my mom? Why didn't she get this medication? They're more like, wow, I can't believe my mom today. It's wonderful. And it's just naturally makes them feel a whole lot better that they're hearing that rather than just the complaints.
Yeah, that's awesome. I know, like, as a physician, when you go from just medicating people all the time and basically, you know, throwing drugs at symptoms to actually curing people, getting them better, it just changes your whole outlook. And the number of physicians that have done that now that I'm aware of, it's literally changed their entire career. And a lot of them, they want to get out of the standard medicine and go into their own practice so they can do this. What about the other residents? I mean, the ones that are still mentally able to observe these things, are they seeing the people around them that are on these protocols going, wait a minute, are you saying, hey, look at Sally, she's getting better, would you like to try this? Are you being able to leverage some of the other patient success or resident success for some of the other folks?
I do get some of that. It's a little limited. I hate to say it, but a lot of these residents are, you know, they've been a lifetime smoker or lifetime sugar person. And they're like, that's nice, but, you know, I really like my cake, or I really like, you know, I have some that still smoke and are in horrible shape, and I have to get a doctor's prescription for them to do it. But they're like, yeah, I like my cigarette. You know, they go outside and do their thing. So it very much depends on the individual. I mean, I think in general, there are people who want help, that want to get better, and there are people who are just fine with their condition and nothing I can do about it.